Good afternoon. Answer? In the evening. In the evening. Huh? None of the above. The insecticide treated chemical mosquito net. Okay. Now, how much percentage can it prevent you from a mosquito biting you? 90. 90? Okay, this is a very important question. How often does a child die from malaria in Africa, in the continent of Africa? In how many seconds one child dies due to malaria? 60. Huh? 60. Okay. Just remember the question. More than 1 million people are here in the world. How much percentage of these are children in Africa? Is it 30% or 10%? 60%. We'll come back to the answer again. Now, are you scared of getting yourself pricked for the blood testing, or do you voluntarily go and do it? What do you do when you think you have got malaria? Do you go yourself to say, "Can you please check me whether I have malaria?" You know, they prick and then put it in a glass slide. Yes. Are you afraid, or you are brave enough to do it with a smiling face? Yeah, baby. Really? Because I have got some kids now, so whoever is here, I'm going to just check now. When this is happening in Zomba, it can happen in the long way as well. Have you all taken this medicine quarter? How many of you have taken quarter for malaria? No? The first day itself you will feel much better, but you should not stop taking the medicine. You have to complete the course. So by taking medicine at the correct time, you can reduce your absence in the school. If you are absent for a long time, then you skip the class, then you cannot follow what is happening. That means you are going to get low marks, which means in future it would be difficult to enter an university without good grades in the school, isn't it? So it is very important you take care of your health. If you take care of your health, the health will take care of your studies. But if you neglect health, you cannot be a good student. If you cannot be a good student, you cannot go into a better college. And if you don't go into a better college, what is the implication? That means you may not have a good job. Which means again there is a problem of poverty and of unemployment. Now, can any one of you tell which is Africa? Can one of you come and show me where is Malawi in this? Or Africa? You do geography, don't you? So this is the world map, right? Where is Malawi? Yes. Okay, you tell me where is Malawi from, like this, if you can show. Malawi is? Yeah. Is it white or blue in color? Blue. Blue in color, look carefully. Blue is the area where the malaria is more, and the whole of the country Malawi is blue in color. If you want to see, I come from India, this one. This is the whole of India. But in India, what is happening? You see, although the country is blue, that is a small part of the country which is white wax. Have you heard about it? Okay. Among the many types of malaria, there is a common malaria which will not affect us. Whereas there is a deadly malaria. If that particular malaria, if we get, even in 24 hours, a person can die. Or some people go into coma. They lose consciousness completely. You go and check them, they don't wake up, they can't walk. And some people become blind because of that later. Though there is no problem in the eyes, but they become, it affects mostly children under 5 years and the young children. Because it can lead to immediate death, or it can lead to anemia, it can lead to even impaired growth. You see, some people become very short, despite they try to eat, they can't eat. They remain short. It's because of malaria can cause chronic malnutrition. Sometimes, if it is a girl, then the girl grows into a woman. Then when she becomes pregnant, it can still be there in the body, affecting both the child and the mother during pregnancy if somebody has malaria. So it's better to avoid than to take chances. Sometimes there can be a back pain, sometimes fever, but not always. Sometimes it can be just chillness and dry cough. Sometimes people might try to vomit, but there may not be a headache. So if you think that only one symptom is malaria, no, it has got a host of symptoms, a group of symptoms. So you should be able, if even one of these symptoms is present, it's better to go and get yourself checked for malaria. It's better. It doesn't take much time, maybe 10 minutes, 15 minutes, 20 minutes, the result is out whether you have it or not. And if you have it, you start taking the medicine. If you think, oh no, it's just a vomiting, maybe I eat more or I eat what I don't like, that's why I'm, no. Might be, you need to be very careful on that. If you have malaria frequently, you will not be able to eat, your appetite will go down. Even you eat small, you will feel, I don't want to eat. That makes you more. I feel it is better when you are healthy, better you watch your food and avoid junk food and eat proper food. So that when you are having a malaria, your body is strong, it itself is able to fight to some extent. Weak people with anemia will have more severe malaria, and severe malaria will cause more anemia. You see? They are interrelated. So nutrition is very, very important. Eating the right food at the right quantity and drinking enough water, engaging in good sports or in exercises. Some of you think that only after the school you go home and then you start working and then you just want to watch TV and then sleep. No. You should have a very active life at this age. You should be at least playing or exercising for at least 30 minutes in the 24 hours in a day. How many of you exercise or play on everyday basis outside? Can you raise your hand? Up. See? That should be there. You should play, exercise is very important. When you exercise, when you play, your appetite increases. And when you eat the good food, you are able to focus more on the studies. Those people with anemia, they get low marks. Do you know? They cannot perform well in academics. The teacher is teaching the same subject to you and you and you, but one with anemia would grasp less from the same teacher. Whereas the one who is healthy can grasp more things and can perform better. So if you are thinking that malaria is different, my lifestyle is different, I can just sleep and then drink Coca-Cola and then just come to the school because my parents are forcing me to go to school. No, they are all linked together. If you eat good nutrition, if you exercise well, if you protect yourself well, and you stay healthy, that means malaria will also bother you less. But if you encourage malaria to come, you are inviting malaria by not eating properly, by not exercising properly, by ignoring your health. So they are not something, two different things. Now, if I should ask, by killing all the mosquitoes? Even if it is, everyone must be yes, good point. By preventing stagnant water and keeping the environment clean. That is what we are seeing here. Prevention is by sleeping under insecticide treated nets, clean environment, which means don't allow water to stagnate. If you see that it is stagnant, make sure that you clean the place. Then good nutrition. In some times, if the government or if the hospital decides that even without malaria you should take some drugs, you have to comply if it is given by the hospital. Sometimes rarely they do when there is an outbreak. Yes. Now, if you have symptoms, still it is prevention. It is called secondary prevention. Meaning, you are preventing it from becoming worse, or you are preventing it from becoming worse and worse, so that it gives you complication. Like I told you, a person has malaria, but he takes medicine at the correct time, and he prevents it from becoming a cerebral malaria or a blindness. You see where it goes? Still you are preventing it from further worsening. So you should take the medicine as you have been advised, and if you are given Panadol in addition, you can still take it. Okay? Those are transmitted only by female mosquito, not by male mosquito. That is how it is in the nature. How many different types of malaria we have? Somebody said 6, somebody said 4, isn't it?
Yeah.
3. 4 different types of parasites which can cause malaria. Of which the most deadliest is Plasmodium falciparum, which can cause cerebral malaria, as I told you. But there are how often one child died because of malaria in Africa? Every 10 seconds. Every 30 seconds. In 1 minute, we lose 2 children. Up to now, I am speaking to you for 40 minutes, 30 minutes. Imagine how many children would have died in Africa. Meanwhile, you are listening to this talk. Can you imagine? In 1 minute to 2, in 30 minutes, 60 children have already died. As you enter the class and you are still here, now we have lost 60 children in Africa due to malaria related, and it's very serious. We always neglect because we think it is not healing. It's better to take precaution. Somebody said 100 and some of you said 90. That was the maximum answers. And you are right, 90%. 90% you can be safe by, but you have to link these 2 questions. When we say insecticide treated net to sleep, that means you cannot put a net and walk in your class, isn't it? You use it only for sleeping. That means the malaria mosquito bites you also at night. In fact, between midnight and 4 a.m. That's the time you are likely to be bitten by a mosquito which has malaria parasite in it. That's why sleeping inside the net is more important. So that's the answer. In the middle of the night. Actually, it's from the middle of the night up to 4 a.m. That's the time maximum. But it can be at any time. But the maximum chance that it might be bitten. But it can be at any time. But the maximum chance that it might be bitten by malaria infected mosquito is at that time. Okay. What does malaria means? Malaria. Have you heard the word malfunction in English?
Yeah.
What is malfunction? Not working. So mal is something bad. Function is working. Malfunction. So malaria. Mal is bad. Area means air in Italian. So in the beginning, people thought that malaria is because of inhaling bad air near the stagnant water. They didn't know that it is actually transmitted by the parasite, which grows in the water, then it enters the female mosquito, and then the mosquito bites. That's how it enters the human being. So how was it contained in early days? In the early days, they were using less insecticides or less. The malarial mosquito, what is the time most likely that you are going to be bitten by that? Yes?
In the middle of the night.
In the middle of the night?